I thought I had a pretty good life. I had a decent job and I worked all the time. One morning I got up to go to work and I had a stroke. And after I had the stroke, of course, when you have a healthcare emergency, you pretty much lose everything unless you have a lot of money to back you up.
There are mean things happening in this land. There are mean things happening in this land.
Hi, I'm Rhonda Cohen. I live in Bellows, and I've been epileptic since I've been 13. I had surgery to put a vagus nerve stimulator inserted. Before this, I spent every afternoon in bed. If Medicaid had not paid for this, I would not have a life today. What we need is to make sure that there is no cuts in Medicaid and that everybody can get the care that they need.
I was terrified the extra paycheck would bump me just over the income limit for Medicaid. The state of Vermont must expand Medicaid to cover everyone. Thank you.
The COVID-19 virus has shone the light on facts we already knew. Our current healthcare system fails millions of people.
Oh, does healthcare profits soar as we pay more and more? There are mean things happening in this land.
I need my glasses to do almost everything. I struggle to read the board in school without them. I also cannot drive without my glasses because I am nearsighted. I also need my medications to help me thrive in school. This is why I am marching for Medicaid.
I've seen teachers with underlying health conditions who are eager to go back into the classroom to do what they love and care for their students, who also can't afford to lose their health insurance.
Normally, I would get at least 1 weekend a month to kind of recharge my batteries. So without any breaks for this important job and the low pay that we receive, there will be shortages of homes in the near future for people that need a little bit of support to live with others.
We know that Black Americans are becoming infected with and dying from COVID-19 at a shockingly high rate. So when we say healthcare is a human right, we are also saying Black Lives Matter.
For the first 3 months of the pandemic, I worked on the COVID unit up at UVM. One of the most memorable moments I had was while caring for a man in his 50s whose health was continuing to decline throughout my shift. Between gasps, he explained to me that he had been laid off earlier this year, and with that, he had lost his health insurance. Here's a man fighting for his life during a global pandemic, and he's thinking about how he's gonna pay for it.
There's another pandemic going around, though, that many of you may not be aware of. And that's the pandemic of substance use disorder. Everything I do in my work has something to do with people who are suffering from this disease. And I see it every day. When an individual is ready to get the help they need, but they can't get into treatment because they do not have Medicaid.
We'll have healthcare happening in this land when the people take a stand and unite in a solid hand. We'll have healthcare happening in this land.
So that's how I ended up here, and I made up my mind that I will never stop fighting to have health care for everybody who's living, because we need it so much. If you don't have your health, you have nothing. They take everything away from you, your dignity, your life, your property.
An attack on anyone in our communities is an attack on all of us. Because state violence, in addition to police violence, also looks like 200,000 deaths in the United States from COVID. We all need care. We all need the support we need to survive, and the fight for healthcare unites us all. We're joining our siblings in Kansas, who marched for Medicaid on Tuesday. We're joining our siblings in New York, Pennsylvania, Alabama, California, and many other states to demand that our needs be met.
Yeah.